Another day, another video of first aid by. Can a hangover cause a fever? Possible causes, symptoms, and treatment. Hangovers are never pleasant, but when they come with a fever, they can be downright miserable. A fever is generally defined as a body temperature of 100.4 degrees Fahrenheit or higher, and it's a sign that your body is fighting off an infection or inflammation. In the case of a hangover, a fever can be a sign that your body is struggling to recover from a night of heavy drinking. What causes hangovers? Hangovers are caused by the combination of drinking too much alcohol, dehydration, and the toxins in alcohol. When you drink, your body has to process the alcohol, which can cause dehydration and fatigue. As the body breaks down the alcohol, it also produces toxins, which can lead to nausea, headaches, and other symptoms of a hangover. The severity of a hangover can depend on a variety of factors, such as how much was consumed, the type of alcohol, and individual sensitivity to the effects of alcohol. Drinking water before, during, and after consuming alcohol can help reduce the severity of a hangover. Is a fever related to a hangover? A hangover is the result of overconsumption of alcohol and is characterized by unpleasant symptoms such as headache, nausea, and fatigue. While a hangover is not directly related to fever, it is possible that a person who has been drinking heavily can develop a fever as a result of being dehydrated and having a weakened immune system. Additionally, it is possible that drinking too much alcohol can raise body temperature and lead to a mild fever. Therefore, while a fever is not a direct result of a hangover, it is possible that it could be a symptom of excessive drinking. Are hangovers and febrile illnesses related? No, hangovers and febrile illnesses are not related. A hangover is a set of unpleasant physical and mental symptoms that may include headache, nausea, fatigue, dizziness, and dehydration that typically occur after excessive consumption of alcohol. Febrile illnesses, on the other hand, refer to illnesses that are accompanied by a fever, which is an elevated body temperature due to a physical illness or infection. While the symptoms of a hangover and the symptoms of a febrile illness may overlap in some cases, they are not directly related. In this article, we'll explore the possible causes, symptoms, and treatment options for a hangover with fever. Possible causes of a hangover with fever. There are several possible explanations for a hangover with fever. One common cause is dehydration. Alcohol is a diuretic, which means that it causes your body to lose fluids more quickly than it would otherwise. This can lead to dehydration, which can cause symptoms such as headache, dizziness, and fatigue. Dehydration can also cause a fever because it leads to a decrease in the amount of fluid available in the body, making it more difficult for the body to regulate temperature. Another possible cause of a hangover with fever is an infection. Alcohol can weaken the immune system, making you more susceptible to infections such as the common cold or flu. If you have a fever after drinking, it's possible that you have contracted an infection. Other symptoms of an infection may include coughing, sore throat, and body aches. In some cases, a fever after drinking may be a sign of alcohol withdrawal syndrome. This is a serious condition that can occur when someone who has been drinking heavily suddenly stops. Symptoms may include fever, sweating, tremors, and seizures. Alcohol withdrawal syndrome requires medical attention. Symptoms of a hangover with fever. In addition to a fever, a hangover with fever may cause a variety of other symptoms, including 1. Headache. 2. Nausea and vomiting. 3. Fatigue. 4. Muscle aches. 5. Dizziness. 6. Sensitivity to light and sound. 7. Rapid heartbeat. Treatment for a hangover with fever. If you have a hangover with fever, there are several things you can do to help alleviate your symptoms. These may include 1. Rest. Getting plenty of rest can help your body recover from a night of heavy drinking and fight off any infections. 2. Hydration. Drinking plenty of water and other fluids can help combat dehydration and fever. 2. Sports drinks can be particularly helpful because they contain electrolytes that can help replenish the fluids lost during drinking. 3. Pain relief. Over-the-counter pain relievers such as acetaminophen or ibuprofen can help relieve headaches and muscle aches. 4. Anti-nausea medication. If you're experiencing nausea and vomiting, over-the-counter anti-nausea medication may be helpful. In some cases, medical attention may be necessary. If your fever is particularly high or you're experiencing severe symptoms such as seizures, you should seek medical attention immediately. In addition, if you have a history of alcoholism or experience alcohol withdrawal symptoms, you should seek medical attention to manage your symptoms and prevent complications. Prevention of a hangover with fever. The best way to prevent a hangover with fever is to drink alcohol in moderation or avoid it altogether. However, if you do choose to drink, there are several things you can do to minimize your risk of developing a hangover with fever. 1. Stay hydrated. Drinking plenty of water or other non-alcoholic beverages can help prevent dehydration, which is a major cause of hangover symptoms. 2. Eat before and during drinking. Eating a meal before drinking can help slow down the absorption of alcohol in your body. 2. Eating during drinking can also help you pace yourself and reduce your overall intake. 3. Pace yourself. Drinking slowly and alternating alcoholic beverages with non-alcoholic ones can help prevent overconsumption of alcohol. 4. Choose your drinks wisely. Some types of alcohol, such as red wine and dark liquors, contain higher levels of congeners, which are chemicals that can contribute to hangover symptoms. 4. Choosing lighter-colored beverages or drinks with fewer congeners may help reduce your risk of a hangover with fever. 5. Get plenty of sleep. Getting enough sleep before and after drinking can help your body recover and reduce the severity of hangover symptoms. When to see a doctor. In most cases, a hangover with fever will resolve on its own with time and self-care. However, there are some situations in which you should seek medical attention. 1. If your fever is high, above 102 degrees Fahrenheit, or lasts for more than 24 hours. 2. If you experience symptoms such as seizures, confusion, or severe abdominal pain. 3. If you have a history of alcoholism or experience alcohol withdrawal symptoms, such as tremors, hallucinations, or seizures. In these situations, it's important to seek medical attention as soon as possible to prevent complications and ensure that you receive appropriate treatment. In conclusion, a hangover with fever can be a miserable experience, but it's usually not a cause for alarm. Dehydration, infection, and alcohol withdrawal are all possible causes of a hangover with fever, but most cases can be managed with self-care and over-the-counter remedies. Taking steps to prevent hangovers in the first place, such as drinking in moderation and staying hydrated, can also help minimize your risk of developing a hangover with fever. If you experience severe or prolonged symptoms, or if you have a history of alcoholism or alcohol withdrawal, it's important to seek medical attention to ensure that you receive appropriate care. Thanks for watching.